I'm speaking with Chantal Branco. She is an RN and she is the nursing director with one of the intensive care units at LVHN. And Chantal, thank you so much for taking time. I know that we and so many in the community have nothing but admiration for you guys and what you're doing during this difficult time. So thank you again. Around the country, especially in New York, and of course we're not far from New York, we've seen all kinds of stories of very difficult conditions in ERs and ICUs and so forth. Maybe you could give us some insight into what it's been like where you are.
Where I am is actually strangely familiar in that we typically are taking care of mechanically ventilated patients. That's our typical daily workflow. It is obviously extraordinarily busy right now, and it's eerie in a sense that we're caring for, we're fighting for a very serious virus, and having to change our workflow a little bit. But the patient population, we are comfortable with in the sense that we take care of patients in respiratory failure all the time, so that's almost comforting in a way. It's the enhanced manner in which we have to protect ourselves that is, can breed some anxiety. But we have an excellent infection control team here at the network and an excellent emergency preparedness team that has really spent a lot of time with me and my team in the last 3 months getting ready for this. And we're feeling confident that we have, the most up-to-date information from the CDC, and that we're prepared to continue to take care for these patients.
Mm-hmm. Maybe tell me something about some of the patients you're seeing. You have some positive COVID-19 cases or suspected cases, and if so, what are their conditions like?
So currently, all 12 of my beds are full of patients who are positive for COVID-19. Approximately 10 of them are on mechanical ventilation right now. The other 2 are on a high flow type oxygen, and we are managing them, thankfully being able to keep them off the ventilator at this time. The other 10 are very ill, requiring a lot of care. We are using a proning maneuver in which we, as a team, manually flip these patients on their bellies to help improve their oxygenation and their lung mechanics. And that requires a lot of hands and a lot of work. They are very seriously critically ill. But I work with an extraordinarily passionate and intelligent team that's taking great care of them.
Well, tell me about the team. We see elsewhere, but we really have not had a peek into conditions in ICUs here in the Lehigh Valley. What the conditions are like for those who are working on these patients, and how are they holding up? And this must be even emotionally tough.
It's very emotionally tough, and high risk and high anxiety times. But my team, I would argue, one of the most fortunate people to have the team that I have. They have jumped right in, gained all the knowledge that they need to take care of these patients, volunteered to work extra, brought meals in to feed us while we're here for extended hours of time. They have really just stepped up, and I am truly, truly blessed to work with the people that I work with.
You mentioned the beds. I think you said that your 12 beds are full, right?
Yes.
So if we are hearing that there may be some kind of surge for Pennsylvania that may still be 3 or 4 days away, what are you going to do?
We are fortunate to have multiple ICUs with many beds. There is another medical surgical ICU right next door to my unit that is 32 beds. And there are a variety of other specialty ICUs that are ready and have beds available for us to care for these patients if and when we surge the way we expect to do.
As the health secretary of the state said today, that I believe she said that it looked like Pennsylvania might be okay for the number of beds, even with a bit of a surge. You feel the same way about the capacity there at LVHN? It could be okay.
I do that way. Our emergency preparedness team has worked very hard to get a surge plan together as our census continues to increase. And there are daily calls, multiple daily calls in regards to, where our ventilators are going, where we're going to put these patients. And the plan is, reviewed and changed and modified as needed on a daily basis, sometimes on an hourly basis. So I think that we are ready for what surge does come.
Do you forecast those things on the local level? It's one thing to have a state surge prediction, but do you right there in your own unit know or expect to have a surge soon, and how much of a surge that could be?
I do expect that the Lehigh Valley is going to see, a surge that is similar to what some of our other larger cities are seeing. I think this is a critical time to educate people to stay home to try to prevent that from happening. But I will say that we've seen a pretty solid increase in the number of positive COVID-19 patients being admitted to the hospital in the last 10 days or so.
That surge is soon, like this week?
I do.
And you mentioned people working long hours and volunteering to work hours. So today in Michigan, I saw a case where bunches of nurses and other workers walked out because they just didn't have the people and the staff, and they were putting out a plea for more staff and volunteers and so forth. Do you think you'll get to that situation?
I truly hope to never be in that situation. In my particular area of expertise, we have scheduling planning, plans for time here as well as time off. And then in addition to that, our chief nursing officer is working very hard to have a surge plan to ensure that we have the right amount of staff that we need to care for these patients.
Mm-hmm. Do you personally care for some of the COVID-19 patients? And if so, just give me an idea what that experience is like.
I do personally help to care for them alongside my staff. It requires multiple nurses to take care of these patients at any given point. Initially, I think for everybody, myself included, there was an anxiety about caring for these patients. But once we received the proper education and, how to make sure that we're wearing our protective equipment properly and removing it properly, taking care of the patients is what we know and what we do best. So it's almost comforting to be at the bedside and in the rooms with the patients, because that is what is normal and home to me and my staff. And then we have the support of infection control and that team to make sure that we are protecting ourselves when leaving those rooms.
Have you lost any patients?
We have lost one on my particular unit, yes.
In your particular unit?
Yes.
I guess that was a tough experience for all.
It was a difficult experience, especially in a time where, hospitals are not allowing visitors and things like that. It is very challenging to care for patients in that way when they don't always have the support of their family.
Do you have the supplies you need?
Yes, we do. We have an excellent supply chain team, and they've come up with a great plan to make sure that we are getting the supplies that we need.
The others on your team work with these patients. What happens when you go home? Do you self-isolate?
I don't self-isolate per se. I have young children at home. It's kind of impossible to isolate from anything. So I follow the recommendations of my infection control colleagues. I do change out of my scrubs before I go home and shower as soon as I get home before I interact with my family.
All right. Let me just, one more thing. The expectation of this surge and the images we've seen from New York, and of course prior to that from Italy, makes everybody super apprehensive. And we, I guess I said at the beginning, have nothing but admiration for those of you who are on the front lines. But can you assure people who are listening to you that you think the Lehigh Valley's experience may not be as dire as we've seen in these other places, or do you think it might?
I don't know that I can assure anything. Things change like the wind, and especially right now, with the mobilization of this virus and pandemic, it changes from hour to hour, sometimes even less time than that. I can assure that we have a great plan in place to be ready for, whatever type of surge does come. I would just encourage people that the only way to prevent it from getting out of hand the way it is in some of these other cities is to stay home, wash your hands, and clean the surfaces around your house at all times, and stay home as much as you possibly can.
Well, it's spoken like a true RN. Thank you so much, Chantal, for talking to us tonight, okay?
Thank you.
All right. Take care.